Hi everyone, my name's Catherine. We run Breast Cancer Support Pretoria non-profit. We usually have these events online, but due to the lockdown restriction, also the risk for patients going through chemotherapy to be at events, we're hosting our first live session. So welcome everyone. I'm gonna present for you something. Okay, so we host the Know Your Lemons campaign in South Africa. And exactly like the word says, you need to know your lemons. So the campaign is there first to educate you about breast self-examination and then to everyone else. And the reason that it's so important to do self-examination, most areas in South Africa don't have the infrastructure or clinics to do self-examination for patients. So you need to educate yourself first before you can educate others. And doing self-examination can actually help pick up cancers earlier. So this is the 12 signs of breast cancer. They explain it through lemons, which is actually an awesome way to explain it. So like the inner segments of a lemon, you have hard lumps, the seeds, and this is exactly how a cancer would feel. It's immobile, it doesn't move around, and it's quite hard and fixed under the skin. There's a few other things like a thickened area, sudden dimpling in the skin, and also what they call a peau d'orange, orange peel skin, so almost like cellulite, but on the breast surface. So these are all the different things that it could present like on the breast. When you do self-examination, as long as you don't skip an area, there's really no right or wrong way or where to start. As long as you don't skip any area, and remember to also include under your armpit. So when you also feel soft mobile lumps. These are usually benign, non-cancer things, soft peas like texture, and then the hardest seeds can most likely be something like cancer. When you find a lump, then what exactly do you do? So if you find a symptom, you would go to your local clinic. If you are more in a rural setting, or you will go to your local GP, let them also do a clinical breast examination, and then they will decide if you need to be referred either for a mammogram if you're over 40 or for an ultrasound if you're under 40. And based on these results, they'll have a look and see what's going on. If there's anything that looks suspicious or that they're worried about, they usually do a biopsy. Now, biopsy is very minimally invasive. They do a tiny cut on the skin, 2 millimeters. They usually anesthetize, so they numb the area. And then they have a special needle that goes in. It has a hollow inside, and some of that tissue falls in there, and that they can send away to get some answers from the pathologist. There's also an app, the Know Your Lemons app, that you can use. It also gives monthly reminders to do self-examination and all the different signs. And there's quite a few nice things on it. An exam coach that shows you how to do it, screening plan, and then also just your reminders to have your annual or monthly checks done. When you do self-examination, like I said, just don't skip any part. And the best investigator of your breast is you yourself. You're with them 24/7. And if you ever feel something or you're unsure compared to the other side, or go let your physician or clinic nurse have a look. Because the reason we do self-examination is we can pick up interval breast cancers. And these are the ones that tend to hide on your annual examinations with your doctor. And in between your annual examination, it actually pops up. And the only way you'll know is if you do self-examination. So thingamaboob is actually a very nice way that they use to show how accurate a mammogram is. So when you yourself do self-examination, this would be the size of a mass that you would feel. If it is your GP or nurse, clinic nurse, this is what they would feel. If it is specialists working with breast, like for example, a gynecologist, and then the smallest one here, that's about the size that a mammogram would pick up if you have it done annually. So this is just a reminder or an idea of just how good self-examination can be. Very important thing is teach your daughters. Show them how to do self-examination, even at a young age, even if they are in their late teens or early 20s. The sooner we start breast education, the sooner we can save lives. Remember that breast cancer only has about 40% have a family history. Most of them don't have a family history or even a risk factor involved with it. So it's very important to start becoming aware of your breasts, any changes, and have it checked out. Okay. Like I said, only 14% of all breast cancers have a strong family history. And then there's also things like the BRCA1 and 2 gene mutations. There's a bit of a misperception about the BRCA gene. We all have the BRCA gene. It's a breast cancer tumor suppressor gene. So it's actually in our bodies to prevent any abnormal cell growth. But in some people, this gene is mutated, it's abnormal. And so instead of preventing abnormal growth, it actually encourages it. And if you test positive for this gene, they say that you have about 70 to 80% chance of developing breast or cervical cancer at some stage in your life. So normally what they would suggest, it's a whole team that looks after such a person. You have a genetic counselor and everything, and they will then usually suggest to do preventative surgery, to have a mastectomy now before there's a breast cancer, to ensure that you have longevity of life. And it's a very difficult decision to make. So if you have a very strong family history, your mothers, grandmothers, aunts, all of them had breast cancer, consider having this done, but keep in mind it's something that needs to be approached by a whole team of specialists that help you and can counsel you through the whole process. So, do you know where your diagnostic centers are? Do you know which hospitals, which interprovincial state hospitals are there that actually provide mammographies and biopsies? And do you know if there are any oncologists in your area? You need to be aware of these things because you typically only become aware of it when you test positive for breast cancer. And then you have no focus. You can't even concentrate on what needs to be done. So it's very important that you know where your centers are. All right. So then another one that I want to show you is this one about missing data. So this was actually something that was presented at an International Congress for Women in Ethics. So in all countries, there's quite an interesting role with COVID happening now, and I'm sure we're all quite tired of hearing COVID, but this is a reality, and it's actually quite interesting to see how COVID affects specific disease types and how it the effect it has in South Africa. So this is a bit more of a medical output, but I still want to share it with you. Okay. So in 2030, they expect that there will be a global shift of breast cancer occurring in low and middle income countries. And they say the reasons why is because there's this vast growth in population and also people adopting a Western lifestyle. And that, in essence, is actually just an unhealthy lifestyle. Breast cancer globally is the 5th leading cause of cancer death. And this is mostly because the diagnosis is quite late and there's not access to treatment facilities. And this is typical of our South African population. But there's a lack of data in South Africa. Most of the stats that we have is limited to Zimbabwe, Uganda, Malawi, Eastern Cape, and South Africa, and it's quite outdated. The most recent ones go up to 2012. So South Africa is seen as a middle income country, and we have both public and private hospitals, like we all know. So there's quite a few things that have led to healthcare inequality post-apartheid, and then also socio-economical discrepancies between various racial groups. So the lifetime incidence of developing breast cancer in South Africa, but this is based on outdated data from 2005, is that 25 out of 100,000 women, or 1 in 36 women, will develop breast cancer at some stage in their life. And by 2009, 85,000 women in South Africa have been diagnosed with breast cancer. Just going to pass through this. So in South Africa, what did COVID have an effect on for breast imaging centers? So in South Africa, as it is, there's a lack of appropriate surgical centers, chemotherapy and radiation therapy, all the different treatments that are used to treat breast cancer. And there's also not enough quality healthcare professionals. There's a lot of healthcare professionals that are exported overseas, and very few actually specialize into specific fields of study. Also, there's a lack of infrastructure, and we have high patient volume. So the public hospitals have excellent facilities, but there's such a high patient volume that the waiting list to actually be seen by a doctor is quite lengthy in time. Other things is also we don't have all the anti-cancer medications. There's also a lack of it being provided on a public level, and also, which is a very sad thing. So if someone is tested for breast cancer and they pick up that it's advanced, late stage breast cancer, then they typically do what they call palliative care. So this is at the end of your life, it's very advanced, and they're actually just easing your process into the next life. And the sad thing is there's a lack of palliative care nurses and doctors in South Africa. So most of the patients are sent home without proper palliative care. And this is a gross unethical misconduct and direct violation of the Constitution. So there's so many things as it is already lacking in South Africa, but now that COVID has also come in, it has even worsened the effect. So we have a lot of non-communicable diseases such as TB. We have a few lung-infected diseases, and also stuff like HIV and AIDS is quite high in South Africa. So the World Health Organization has development goals, and they are promising that there will be some stability in the economy globally, and there will be a reduction in poverty, and healthcare will be equally provided. There won't be inequality anymore. But currently, South African resources are focusing on HIV, TB, and other infectious diseases. And a lot of patients in South Africa with breast cancer have a secondary disease, either hypertension or obesity, which makes it worse for treatment purposes. And that is currently what is happening in South Africa, is that with COVID, all the resources have now been focusing, obviously, on the pandemic, making sure there's enough beds, enough testing kits, and everything. But this has led to the healthcare of breast cancer patients being postponed. Treatment, the routine imaging studies, all of that has been postponed because of the risk of coming just for routine studies. And this has now led to a major backlog in the public hospitals, and also the fact that there's not that constant education about breast self-examination. All right, so that's just some of the interesting bits. Then some more background on what we do. So we do the Cancer Care Package campaign. We started with it about 2 years ago. I noticed myself, I'm a lecturer at the University of Pretoria for the Faculty of Health Sciences, and then also the director for the nonprofit. And I worked as a mammographer for many years in practice. And something that I noticed is there's a lack of support and education for women that are diagnosed with breast cancer. And along with that, there's a lack of knowledge being shared with them about products or items that can be used during their treatment. So with chemotherapy, for example, there's a lot of side effects, and not all of them are explained to a patient. And when they go through it, they feel they need to suffer in silence going through it, which is very sad. So our products that we include in the care packages aren't just for niceties, like, for example, a candle or a something. It's actual items that can be used during treatment. Aloe vera products are very good for skin related conditions that occur during chemotherapy. And then we also include things like dental health. Very few people know that they suffer from dryness in their mouth. They suffer from mouth sores during chemotherapy. And we actually collaborated with the company Allocare. They are available in Dis-Chem. Excellent products where they actually have a whole resume of before treatment. There's a set range that you use to clean out the bacterial, any possible infections in your mouth. During treatment, something that's a bit more softer and gentle. And then after treatment, also to maintain your dental health care. They have a whole range of it, and we usually include their pamphlets and a few of the items, which can then be used for that. Hi, Anthea. Okay, so we have Anthea that's joined. Anthea is going to help us as an ambassador in the Centurion region. Thank you for that. All right, so I was just going through what we include in our care packages and what we do. We also have a booklet. I wrote a short booklet. Another thing that specialists tend to do is not be able to explain what breast cancer is in layman's terms. So what it is, what is chemotherapy in a language that they understand. And even things like going into theater, having the surgery done, how it will look, what to expect, and other things. Also, how do you tell your spouse? How do you tell your young children? How do you tell your older children you have breast cancer? So there's a short little booklet. We're actually going to have an extension on that with tips and tricks, people that went through chemotherapy, stuff that they learned, stuff they wish they knew, that we're also going to include. So we have a few ambassadors across South Africa, which is quite exciting. That's helping us to reach more people in South Africa, because we actually started in Pretoria North 5 years ago. We were 40 members, and now we are over 66,000 on a digital platform connecting through this. So our hope is that this year and into 2021, we can extend more of these products, more of these care packages out to women, and also try and get more support groups for regions. So we usually have an ambassador in a region, someone themselves that went through breast cancer or knows a family member, and they promote education and support in their region as well. So, Anthea, do you have any questions? Anything you would like to know? You're welcome to ask. You can just put your mic off, your mic on at the bottom, and you'll be able to see, you'll be able to speak, or I'll be able to hear you. No questions? Okay, I'm going to share another presentation. This is some of the stats of the care packages that we did previously. Interestingly enough, there's quite a few far-reaching places that have connected with our nonprofit. Obviously, most of them are in South Africa, but we actually have a few members from international places. USA, United Kingdom, and then also Zimbabwe, Nigeria, Lesotho, even New Zealand, Australia, and India, and also in Canada. Never thought that we'd have that much of an outreach, but it's clear that the need for support is lacking globally. Most of our support areas are in the local main city hubs, Pretoria, Cape Town, and Durban and Joburg. And we've had more and more outreach towards Soweto, Polokwane, also in Bloemfontein, and also Pietermaritzburg and Rustenburg. We started a youth campaign. We have a few of the students from University of Pretoria that are doing volunteer work. They are based in areas such as Soweto and Atteridgeville, and they're also going to promote breast cancer education and awareness in the next couple of months. I'm very excited about that. Another interesting thing that I want to show you is there's a misperception that breast cancer only happens at this age group, when you're very old. But we've seen more and more women in their late 20s and early 30s being diagnosed with breast cancer. The reason we do not know, but I would love to see when they have updated stats in South Africa to see what is the reasons for it. Again, it is assumed that it might be from Western lifestyle, much more stress, high-driven work that we do, and it's a stressful lifestyle, unhealthy eating habits and living habits. All of these things can account for earlier onset of breast cancer. Right, then this just also shows where most of our members are situated, but we're hoping we can outreach even more on our Facebook page and even just on our support group. In the last year, we had about 500 care packages that we handed out. Most of it was from sponsors. We had Adcock Ingram, Caxton magazines, a few sponsors, and Allocare. We're hoping this year we can get more sponsors to help us out. So this was from a previous time that we did the care package campaign. This was really awesome. We actually had some of these ladies in the top picture. They were breast cancer survivors, or actually currently going through treatments. And they brought their daughters or their friends or their sisters, and they came together to help pack the care packages for other breast cancer survivors. Here at the bottom, this is the booklet that we had made, that we have actually published, that we also include a bunch of magazines. And then these are the Allocare products. Awesome products. We're hoping to include them again in our next campaign. To also help promote the use of dental health care during chemotherapy. Okay, this was also the care campaign. We discovered a region in Polokwane, rural Polokwane, Malaichi, not sure how you pronounce it. They have a increased need for care packages, and we are sending them out again now. We have an ambassador there. She discovered a need in her surrounding area, and she's helping us to promote breast cancer education in this region, which is awesome. So what is in a care package? So we have booklets, what to expect, an ambassador booklet, contact information for other support groups, and then also things like ginger sweets. There's a lack of knowledge with people that have nausea from chemo. Very few of them know that ginger sweets, and there's a specific range that we make use of. It's sugar-free, quite healthy actually. Ginger tea, anything ginger related is very good to curb nausea, and it's actually a natural anti-nausea remedy that can be used. Then we have a bunch of aloe vera skincare products and also some oral healthcare products from the Allocare range. And then obviously a small little something for the person, some branded earrings from Zalmies, and also a badge from the nonprofit group. Again, I'm showing the 12 signs of breast cancer. So this is a very tongue-in-the-cheek way of showing what breast cancer can look and feel like. But the great thing about this, instead of your typical leaflets that you have that are quite blunt, and it's usually just a picture of a lady doing self-examination, this is lemons. We all know what a lemon looks like. We know what it feels like. And the inside of a lemon is exactly how the texture of breast tissue feels when you do self-examination. It's a great way to figure out what's normal and what's not. So these are the 12 typical signs that people will come into a doctor and say, I've noted this, I'm a bit worried. These are usually the ones that we see that are associated to breast cancer. What to feel for. So just like the inner segments of a lemon, when you do self-examination, the breast also consists of lobules, like the segments of a lemon. So when your hand goes over the breast tissue, it feels bumpy and lumpy, but that's the normal lobules and texture of the breast. The most important thing to recognize is that it's a constant ebb and flow, normal bumpy texture, and both sides feel like that. But the moment you feel over the breast, you feel something hard and fixed under the skin, feels like a lemon seed, and you compare it to the other side and you feel that it's not the same on the other side. These are the types of things that you need to have checked out at your local clinic or at your local doctor. Okay, and then the typical process, if you feel something, most people freak out and they don't know what to do now. Most importantly, be proactive about it. If you feel something, regardless of your age, go to your nurse clinic, go to your local GP, have them also do a skilled clinical breast examination. They will then refer you for appropriate testing if need be. So if you're under the age of 40, you'll have an ultrasound done. Over the age of 40, you'll have a mammogram done. And then based on these findings, they will see something, and from this, they will decide, do we need to do a biopsy? Do we need to send some of this tissue away to have it checked out? Or is it not worrisome? We'll just do short-term follow-up. In the next 6 months, you come again, we'll just have a look again. It doesn't look like something you need to worry about. So this is on the Know Your Lemons app. We are hoping also to launch our own local South African app, Temba. As you all know, Temba means hope. That has local support groups and educational material. This is a great one because it gives you monthly reminders. There's also a coach that shows you how to do the self-examination and all of that. With self-examination, there is no right or wrong way. There's a lot of methods that they use, star shape, going around in circular motions. Most importantly, don't skip any part of the breast. And remember, your breast isn't just the part that makes up your cleavage. It's actually against the chest wall, under the armpit. All of that is part of your breast tissue. You are the best investigator of your breast. The first person that will know something is wrong is you yourself. You live with them 24/7. You will know when something feels out of the norm or something feels different. We have this thingamaboob from Bosom Buddies. Very cute. It's actually just a keychain, but it actually shows what the size would be of a cancer if you do self-examination. So if you've never done it before and it's the first time you're doing it, let me just get the pen. You'll probably feel it about this size, which is pretty big. But if you start doing it more often, you can actually start picking it up smaller. When you get well acquainted with self-examination, you know what your breasts feel like. After a while, you'll actually be able to pick up smaller ones. And then your specialist or your GP, they will pick it up at about that size. And the tiniest one of them all, this is literally a few millimeters, is what's picked up with a mammogram. And mammograms, there's a lot of hoo-ha around mammograms and that it's bad and that it's risky, but it's not the case. Breast cancer, the best way still, the golden standard to be able to pick up breast cancer is mammograms. Mammograms have progressed so much in the past couple of years, past few years. Mammogram is not a snackwitcher. It doesn't hurt. It's not there with the intent to injure you. A mammogram is literally your breast lying onto a surface. It's usually cold because the machines specifically need to be kept cold for the X-ray tubes not to overheat. And then a Perspex panel lies onto the top surface of your breast. It's not squashing you. That's not at all. And no one that works in the field gets pleasure in putting the top surface onto your breast. And the whole reason they do that, if you think of the breast is not evenly, it's more thicker against your chest wall and it comes up to the tip. Now, if we were to take an x-ray just like this, it would just be a blob of tissue. We wouldn't be able to distinguish anything. So the reason they bring down the panel is to get the brush all in the same width or the same density. And then we're able to see tiny little things hidden in between the breast tissue. The tricky thing that comes in is that the normal glandular tissue in the breast look white on the x-ray. Breast cancer also looks white on the x-ray. So it takes a very fine skilled eye to be able to see abnormal white in between all other white glandular tissue. So typically what they will see, one of the first changes is microcalcifications. It's tiny little dot specks, and this is literally when cells have just started to grow abnormally, and you actually see this on the mammogram. It's very faint, very subtle, and that's one of the first early changes, and the hope is with a mammogram that we can pick it up then. Before it's even a mass or something that you're feeling, we can actually pick it up as microcalcifications. And then with ultrasound, that's used for if you, the clinical term is if we note a palpable mass. So if a patient comes in and they say, I feel something, I'm a bit scared, unsure what it is, ultrasound is a great way to do that. So the same ultrasound that they would use, for example, if you were pregnant, it's just a different probe. It's a flatter probe. It looks more superficial, not as deep as in your tummy. And we can look very nicely with ultrasound to see what it is. Is it just fluid? Is it a mass? Is it something solid? Is it something that needs to have a biopsy done? Any questions from anyone? Anything that anyone is uncertain about, you're welcome to put it also in the chat in the right-hand corner, top middle, there's a chat bar. You're welcome to put your questions in there if you have any questions. Welcome to ask anything. Any questions for anyone? All right, so if you've seen on our Facebook page, we've encouraged people, if you've recently been diagnosed and you need a care package, please reach out to us. You can email us at info@breastcancersupport.co.za, and we will get your details and send a care package to you. Also, if you had a previous history of breast cancer and you would like to support other women going through it, please be part of our ambassador campaign. We're always in need of more ambassadors to be able to spread the word and start education in their area. We also provide them with educational materials so they also even learn more themselves, and we provide them a little certificate to say that they are now ambassadors for the support group. And then the care package campaign, please let us know if there's anyone in your region. Most importantly, for any of you going through breast cancer, don't feel like you need to go through it alone. There's a lot of women around you that have been through something similar or had a family member that has gone through it. And it's really important to make use of your support groups. Don't be shy to ask for help going through treatment. You need to take care of yourself, and we're all very work driven. We need to reach deadlines, but when you have a diagnosis, you need to take time for yourself and you need to focus on getting better in getting through the treatment. And I can say from a clinical point of view, having worked in the field, the treatment is tough, yes, and you're going to have all of the emotions going through. But all of the patients that we have diagnosed, a year later, they come back for their annual checkups and they are fine. They are stronger, they are more driven, and it changes who you are, but in a good way. It changes your perception of what is important in life, and it helps you to be more focused on what's important in your life. So I hope this talk helped a bit. We have it as a recording. I'll be posting it on our Facebook page for all of you to have a look at, and we'll also put it on our website. So we also have a website, www.breastcancersupport.co.za. I add interesting informational documents and things on it. And then the moment that we have access again to physical events, please invite us to your local area. We'd love to host events there, get a speaker to come talk about breast cancer related items. And yeah, thank you for everyone that's joined.